morning and welcome to Health Talk on AM 1270 and 96.5 FM KXBX. I'm Paul Thomas, and with me in the studio, as always, is Mr. Bill Kearney of Northlake Medical Pharmacies. But in reality, Bill,
yes,
you are on a tropical island.
Yeah,
probably in board shorts and holding a Mai Tai.
I don't even know where I am, but I do know that I'd be, and I know I'm not going to be in board shorts because I don't wear them, but I'm not going to be naked.
Okay.
I'll probably be holding a cocktail, but
sure.
We don't know exactly when this will play, but anyway, we're here today and we're going to be talking about a lot of things dealing with drugs, and sometimes we get off on other things because of politics and those kind of things, but we're going to mainly talk about medications and foods and those kind of things that new things are happening with at the new year. And so one of those is a nasal spray that you can buy over the counter, fluticasone, which is a drug that's been on the market for some time as a brand name, Flonase. And it is over the counter now, and it comes as fluticasone, or it comes as Sensimist or Clary spray. And the one thing we want to remind you about is Clary spray makes you think that it's going to be a Claritin type product. It's not. It is. It's a cortisone product. So even though it's the over the counter version of Veramist, it's being discontinued. So we find that. With a lot of medications, once they come out with a generic or an over-the-counter, it's pretty hard to find the brand name anymore. So people need to know that it's about the same as Nasacort, about $25 for 120 sprays, similar to the other steroid sprays that are over-the-counter. And the Clara spray actually has the steroid in it too, so don't be confused about thinking it's loratadine or an antihistamine. Both brand names start with Clary, and their packages have similar colors and graphics, so be careful when you're picking up a spray, because if you're using a nasal spray, there's the favored kind that for years and years and years was neosynephrine. And then we got to a drug called Afrin, which is oxymetazoline is the generic name of it. And Afrin is much stronger than neosynephrine, and you can only use it for about 3 days before you get a rebound effect. And that means the more you use it, the more you have to use it. and that's something we have to try to avoid. Well, what happens then if you can't use oxymetazoline or Afrin? Many people we've told to go to normal saline, which is like ocean spray, which will moisturize the nose and make it easier for you to breathe. But steroids always used to be a prescription item, and it was never an as-needed medication. It was always on prescription, and you had to use it for 72 hours before it became effective. So that nasal steroids work about the same way, all of them, but it's not actually something that works instantly. So it's going to take a couple of days for it to be effective. The Flonase one is approved for ages 2 and up, and the Allergy Relief is approved for ages 4 and up. And before that, we weren't using steroid sprays for even prescription medications for people that young. So you don't want to accidentally double up on these sprays and show where there's a lot of inactive ingredients on the over-the-counter labels. So we need to be careful about what those are. Now, steroid sprays have a different kind of side effect. They're anti-inflammatories. So steroidal sprays, even though they're over-the-counter, work by an anti-inflammatory situation where the bronchi, the tubules that go into your lungs, it opens those up so you can breathe easier. But it takes it some time for it to be effective. So where neosynephrine or Afrin or ocean mist saline spray can be used right away for a rescue inhaler, a cortisone or a corticosteroid type inhaler takes it longer for it to work. Not that it doesn't help, It does, but it doesn't become maximally effective till about 72 hours. And as they're lowering the dose for pediatric use, they're making it so it's more effective quicker because children are less apt to be patient enough to open up that airway. As we get older, we take more medications, and there are side effects that come with taking medications. And you've heard me many times talk about the benefit and the result. Is the risk worth the benefit, or is the benefit worth the risk? And certain meds have side effects, and many times those side effects aren't anything that's detrimental to your health, but they can make it uncomfortable to take the medication. And one of those is taste buds. As we begin to age, we lose a lot of our ability to taste anyway. So that taste change may impact whether or not you take the medication or not. And one of the type of drugs that we have for high blood pressure is called an ACE inhibitor. That's lisinopril and Capitan or Captopril, enalapril, losartan. They can dull the taste or even cause a bitter, metallic taste or even a sweet taste. And seldom we don't, when we do the consulting to have you take the medication, we don't make a big deal out of this because it's very minor usually, and it's one of the minor kinds of side effects. One of the other side effects with those kind of drug, ACE inhibitors, is you develop a cough. And it's not a cough that's controllable, and it's not one that goes away. No matter what you do, it will be there. It's very unproductive. It's not deep in your chest. It's just in your throat, and many times you can't take an ACE inhibitor because of that cough, and sometimes because of that taste. Very seldom the taste, but the cough is something that we're very significant about informing you. And that can be just by changing an ACE inhibitor to a different brand, can many times avoid it by going to what we call an angiotensin blocker, which is an ACE inhibitor that has a blocking agent in it. That can be more effective. So you just need to be aware that those things can happen, and you need to interact with your pharmacist when they do, or your physician. And we can usually change it to a medicine that's just as effective, taking it the same amount of times a day, and get the job done as far as being your drug of choice. Many eye drops and nasal sprays also can drain to the back of your nose and throat and give you a bad taste in your mouth, but that usually does not last very long. Most statins, and God knows the amount of people that are taking statins, atorvastatin, simvastatin, lovastatin, pravastatin, all to lower your cholesterol. They can also reduce or alter your taste. Now, it doesn't have to be, excuse me, it doesn't have to be to the point that you avoid taking it, and we're all, mostly over 50 who start taking these medications, and your taste buds are already being altered some way. So this may just make it more significant, and you don't realize where it's coming from. So we're already talking about statins, we're talking about high blood pressure, we're talking about steroid spray, some antibiotics, metronidazole, which is Flagyl that a lot of people take for an anaerobic bacteria, clarithromycin, all of the quinolones, the levofloxacin. They can also cause some metallic or abnormal tastes, and I know for sure that the Flagyl does, the metronidazole, and the clarithromycin does, and it's like it's what I would imagine a goat chewing on a tin can. I don't know, Paul, if you've ever chewed on a tin can or not, but
not recently.
Not recently.
No.
Probably in the early days.
Probably in my youth at some
might
point.
have been a beer can, or
could have been. Yeah.
You know, when you get hungry as a teenager, you got to have something to chew on.
Right.
So, but if you've had to take one of those antibiotics, it could probably happen. And then antidepressants also. That amitriptyline, fluoxetine, that's Prozac, and Elavil can also distort or dull your taste or dry your mouth. Metformin, which is glucophage, a drug that we take for diabetes, also can do that. And the good news is that most of those taste disturbances are temporarily or reversible, that you might suggest a medical switch of something that does the same thing like we were talking about. For an example, an artificial saliva, and a lot of people that are taking beta blockers, for example, have a dry mouth. A lot of chemotherapy causes you to have a dry mouth, so a lot of people use Biotene or something similar, which is a saliva replacement, and it will help alleviate the taste of that metallic taste that you take. Or this is something that I didn't know, and I've been around a long time, but if you gently apply pressure to the inner corner of your eye after instilling eye drops, that will limit the drainage into the tear duct where you get that metallic taste or funny taste from taking an eye drop. So make sure, that you ask your pharmacist and physician if there can be an issue with the medication you're taking, and as it's very easy to see from this that there's almost every kind of product that you can take for almost every kind of diagnosis can cause you to have some sort of a side effect. A lot of people have kidney stones. I've never had. Have you, Paul?
I have had kidney stones a couple times.
And did you have trouble passing them?
Well, the first time I had them, I went into the hospital and they put me in some machine that rotated around me, and what I was told was that they were going to shoot microwaves or something in it to break it up. And I never felt anything past that time. The other time I went in, I didn't get to go to that machine. They just gave me a painkiller and the take-home kit, which includes the little net that you're supposed to catch them in.
Yeah.
And that time I felt them pass through, and I actually caught it and still have it. But that was a little bit painful. The passing of it wasn't as painful as the passing from the bladder out wasn't as painful as from the kidney to the bladder.
Right.
That was where the real pain is at.
Well, you saved it. What do? Bring it out for cocktail parties?
I don't know. I just have it in a little box up in my bathroom cabinet along with Matthew's teeth. So it's like the old family heirlooms.
Oh, yeah. Well, rather than bringing the thing of ashes out that this is your dad, I guess bring out your kidney stone. And
Sure.
Well, there are what we call alpha blockers now that are used to relax the ureters to help pass renal stones, and there's kind of conflicting evidence whether it works or not. Flomax is one of those, which is tamsulosin. Mini stones that are smaller than a pencil eraser may pass on their own, but new evidence suggests that the alpha blockers are helpful for larger stones from about 5 millimeters up to the size of an M&M candy. So about 1 in 5 patients will pass these larger stones, and they may pass a few days faster when there's an alpha blocker with it. What an alpha blocker does is people that are having trouble urinating, mainly males, get on Flomax to relax the ureter, so the urine will flow easier, so you don't have to get up 8 or 10 times at night to urinate. And as they relax the ureter, it also lets something that's a hard surface go through much easier. So when an alpha blocker is used for 4 weeks compared to a placebo, it seems to work. That people with larger stones that don't pass may need to have what Paul was talking about, a kind of a laser to crush the stones that don't pass, and they may crush them or remove the stone. So nonsteroidal anti-inflammatories are good for pain. They don't decrease the spasms, but they work as well as opioids, which we'll be talking about in a few weeks about the danger of those. And in fact, the need for rescue pain meds is a lot less when you're taking an anti-inflammatory. So again, a side effect of a medication that does not have a diagnosis to help that. but it normally does help it if you use it for long enough and the stones are big enough. There is a condition called orthostatic hypotension. That is when you go to get up quickly, you pass out or feel like you're going to pass out. And up to 20% of people over 65 have drops in their blood pressure on standing, often due to the meds or Parkinson's or diabetes. And what happens is the medications or the disease, when you go to stand up, the blood drops down to your toes too quickly. If you go to stand up too quickly, that blood carries oxygen. So when that blood drops to your toes, there isn't any oxygenated blood in your brain to keep you from passing out many times. And that's why we tell people when they go on these alpha blockers and they go on some of the diabetic medications and they go on some of the blood pressure medications that they're very careful about standing up quickly because that can develop. So if you aim to improve those symptoms of lightheadedness and dizziness and fatigue, many times you make sure that your patient knows about these and they're on their feet and functioning. There's a lot of medications that do this to you. Tricyclics, like we were talking about, Elavil, muscle relaxants like Soma, and antipsychotics and Parkinson's medications, and many times lowering the dose will help. People who are taking levodopa for Parkinson's, Reniprol with one or more 2 glasses of water lots of times is enough to counteract the drop in blood pressure. Diuretics like Lasix or furosemide or hydrochlorothiazide, Maxide, many times they can cause you to have uncontrolled hypotension. So, and even drugs for high blood pressure can cause those things to happen. So, there are kinds of drugs that you can switch to in order to calcium channel blockers, for example, to use instead. There's also just non-drug measures, such as just getting up slowly, and that's what we will teach you or talk to you about when you get on some of these drugs, and limiting heat exposures and avoiding alcohol. All these things can add to the hypotension, so don't rely on a knee or thigh-high compression stockings for that, because there's not much evidence that they help. Not that they don't help for other reasons. For people having high pressure in their legs and blood clots and those kind of things, but not for orthostatic hypotension. So you're still increasing water and salt intake if needed. There's med options for patients with diabetes and Parkinson if non-drug measures don't work. Sometimes cortisone type preparations to increase the sodium and water retention, but then you have to recommend monitoring for high blood pressure and edema, which is excess fluid. So when you're treating one thing, you're going to have side effects of the other thing. So there is all kinds of symptoms that the end result is the fact that you stand up too quickly and you feel like you're going to pass out. Some antidepressants do that. Paxil is famous for doing that in elderly people, which is paroxetine as a generic. So if you're one of those people that are having it, it could be the result of taking the wrong kind of medication or the wrong, not for the high blood pressure medication, but it could be the wrong antidepressant. It could be an alpha blocker, which you're using for high blood pressure, or an ACE inhibitor, which is not working very well, and you can switch it to something else. Now, this one kind of bothers me because I didn't know this before, and I get confused as we're doing things and we're telling people don't take this medication because it's not going to help you, or you should take. Everybody should take statins regardless of the side effects in order to keep you from having an embolism or something similar to that, an inflammatory problem where you die of sudden death or something like that and keep down the inflammation. But here's one about an interaction with simvastatin or lovastatin and Pradaxa, which is a blood clotting medication. These combinations seem to increase a bleeding risk. Simvastatin or lovastatin might increase the Pradaxa absorption and drug levels by inhibiting a certain protein, which is a transporter protein that pumps drugs out of cells and into the gut. So if they're taking it and pumps it out of the gut, then it becomes more of a liability. Atorvastatin also seems to inhibit it a little bit, but very little evidence that it is a factor with taking Pradaxa. So other statins don't seem to inhibit this protein. If you get simvastatin or lovastatin and a Pradaxa patient, then the physician usually will lean towards a different anticoagulant. If a patient on warfarin starts on an interacting statin, such as simvastatin or lovastatin, then we have to do a better job of monitoring their ProTime or their INR. So again, here we have drugs that we take every day, and it's not uncommon to have a anti-cholesterol drug with an anticoagulant drug. And many times when you have an event and you are discharged from the hospital, you are given these two medications. And one of the reasons that it's simvastatin and lovastatin, or possibly atorvastatin, and Pradaxa or warfarin, is because those are all generic now and a lot less expensive than using a brand name, and that could be $300 or $400 a month. So we're just having to do a better job of watching what we're doing, and as we see healthcare transition into more and more secondary workers with nurse practitioners and physician's assistants, and less physicians available to do that, sometimes they are just as well informed, if not more informed, and they'll be very careful about doing that. But us as pharmacists also have to look at the med guide and make sure that when we're managing, we are responsible for medication therapy management on almost any patient that has Medicare D. So anybody over 65 that's on Medicare D, we are asked to manage their medication for them, and if a physician is ordering something that shouldn't be ordered for an elderly patient, then we need to bring that to their attention. Now, physicians are very busy. Nurse practitioners and nursing assistants are very busy. But when we tell them that this is a problem, they're going to be rated by the insurance company, and their reimbursement is going to be affected, and their patient is going to be affected if they don't do something. Now, it's difficult for us to tell a patient what to change them to, but in speaking with physicians lately after the first of the year, they want us to give them an alternate. If they can't take the medication that they prescribed them, and the insurance company doesn't want them to take the medication, and they're going to get less reimbursement if they give them that medication, they're going to be eager to make it right. Now, I'm not saying that Medicare is right. I'm just saying that we're all rated by that, and the patient may be a little bit inconvenienced, but may have to take a medication more often than once a day because of that, because we have been taught to make it as easy for a patient to take their medication as they can, and we would have a less of a compliance problem. That if patients had to take a medication once a day, they would be more likely to take it in its entirety than if they were supposed to take it 3 or 4 times a day. And I'm an example of that. The medications I take is 4:30 in the morning. And if I had to take them at 11 o'clock and 4 o'clock and 9 o'clock, I wouldn't take them. Not that I don't want to take them. It's just that you work all day, you get home, you get into a different routine, and unless it's life-threatening, you want to make it as easy to take as you can. We're going to take a break, and when we come back, we're going to talk about some more of those drugs that have a problem, including muscle relaxants. Hi, my name is Bill Kearney, pharmacist and owner of Northlake Medical Pharmacies. I want to tell you a story of the transition of Northlake Medical Pharmacies. 37 years ago, we left the Bay Area to begin our life as part of Lake County. We opened our first pharmacy across the street from Lakeside Community Hospital. Our mission was to bring affordable prescriptions to the patients of Lake County, as well as free delivery service, charge accounts, service to all 3 skilled nursing centers, and hospice. 15 years later, we had outgrown the pharmacy and opened the second pharmacy in Bruno's in Lakeport. In 2010, we moved our pharmacy outside to a freestanding pharmacy. We began the transition to more of a retail population and began including other services. We now do immunizations and sell more durable medical equipment. We also sell diabetic shoes and lift chairs. Our store is focused on you, the patient. We know you have choices when you need prescriptions, and we appreciate you making us that choice. Northlake Medical Pharmacies with 2 locations, across from Sutter Lakeside Hospital and outside the Bruno Shop Smart.
You, my friend, have connections in the government. Yes, you. USA.gov, the official source for government information on thousands of topics. And like any good connection, there's no telling where it can take you. Why, one day you're getting student loan information. Next thing you know, you need job hunting tips. Today's road construction info could have you searching for telecommuting ideas tomorrow. The more you use USA.gov, the more uses you'll find for it. Passport applications, for example. They've been known to lead to a sudden interest in travel advisories. Our new mobile apps will even update you on the go. So whether you have information to get or ideas to give your government, check out USA.gov. Who knows? Lottery results today could lead to retirement planning tomorrow. USA.gov. With the right connections, there's no telling where you can go.
Attention savers. This important message will change how you save. The Treasury Department is eliminating paper savings bonds from the payroll savings program and going green with Treasury Direct. Treasury Direct is a convenient, secure online savings program that makes it simple for you to purchase electronic savings bonds directly from your paycheck, checking, or savings account. So go online and change how you save today. Visit treasurydirect.gov to open your free account.
A public service message from the Department of the Treasury.
Want to know what I like best about high school sports? I love watching my son run on the field. I love seeing him smile when he high-fives his teammates. I love seeing his eyes light up when his team scores a goal. I love the fact that since he's been playing high school sports, he's making better decisions. And I love knowing that high school sports have never been safer. Why? Because coaches have more information than they've ever had. Training techniques are more sophisticated, and equipment has never been more advanced. Playing high school sports isn't just safe. It's still the best way to give your teenager a healthy head start in life. And that's something I really love.
This message about the value of high school sports is presented by the California Interscholastic Federation and the California State Athletic Directors Association.
All right, we're back.
Okay. We've been talking a lot about drugs and side effects of medications on kind of limiting the kinds of drugs that can sometimes have side effects and be uncomfortable, and then in the end result lead to you being non-compliant on taking your medicine. We've always talked about, and more recently, about the cost of medications and how that's causing a lot of patients not to take their medications appropriately, to the fact that some diabetics were even going into ketoacidosis, which means they weren't getting any insulin released at all. And type 1 diabetics, their pancreas does not make any insulin, so they have to have insulin in order to do it, and the only way they could get insulin was to go into a diabetic coma or ketoacidosis and go to the emergency room and be treated. Because we talked a few weeks ago about the cost of insulin skyrocketing so much, to some people it's $1,000 a month now to get insulin. So in these cases that we're talking about, mostly it's side effects. excuse me. There's a huge focus right now on limiting opiates, which we'll talk about in more depth later. And they raise questions about the role of muscle relaxants. And about 1 in 3 patients with low back pain are on a muscle relaxant, and there's very small amount of evidence that they improve low back. Most don't directly relax muscles at all. It's mostly, the benefit is mostly a sedative effect. There's a lot of muscle relaxants that are on the market that are likely to give a sedative effect, and plus they're linked to respiratory depression, which is meaning slow depression or none at all, and death when used with other central nervous system depressions, and mostly opiates and benzodiazepines and alcohol. And you will hear me talk about in the future about Lake County, and maybe prior to this broadcast about how we lead the state of California in opiate overdoses and opiate deaths, and that means OxyContin, hydrocodone, fentanyl, all of those type of drugs. And then it's very typical that we add benzodiazepines or muscle relaxants to them in order to give them more sedation, because often people with back problems do have back spasms, but low back spasms aren't treated very well with some of these medications. So we recommend limiting the use of muscle relaxants, especially in the elderly. That's one of the excuse me, what we call high risk, the Beers criteria, which is what we use in nursing homes, in skilled nursing, to keep those people from having a lot of falls. So people that are on muscle relaxants are a high fall risk, as well as those that are on opiates besides. And probably a lot of those have sleep apnea, which you put all 3 of those things together, and it's kind of amazing sometimes that they can stand up at all. So consider, if we could, in the future, of suggesting a muscle relaxant only with patients with acute back pain, not chronic back pain. And the difference is whether you have it right now and it's going to go away, or if you have it forever. When you have scheduled doses of a non-steroidal anti-inflammatory or acetaminophen and they don't work or work marginally, that's the time to add a muscle relaxant if you need it. But to start out with a muscle relaxant isn't a good therapy. If it's needed, they suggest cyclobenzaprine, which is Flexeril. It's been studied, and most of it is inexpensive because it's generic now, but it's structurally similar to a tricyclic antidepressant, which is amitriptyline or Elavil. So it may have some of what we call anticholinergic effects, and those are the effects that we're trying to limit. What are those effective? Dry eyes, dry mouth, nausea, constipation, all those things that for the elderly this is going to cause a problem, and for most people it will. Another one that's less sedating is methylcarbamol or Robaxin, metaxalone, which is Scalaxin, and we don't see that being used very much, but it's a very good muscle relaxant that's not sedating at all. They even have less evidence of benefit, and that's why they're not used as much. But a lot of these can cost a lot more than cyclobenzaprine or the Flexeril brand name. So we, as a group that's managing medical therapy for our patients, we have to discourage using benzodiazepines like Soma and Ativan and Xanax, Valium, due to their potential for dependence and abuse. These drugs, the benzodiazepines, are much more difficult to withdraw a patient from than the opiate medication, the pain medication. You wouldn't think so, but in going through clinics where we're taking people off opiates, we take them off the opiates first and then take them off the benzodiazepines because it takes them much longer. We've had them take as much as 3 years to get people off of benzo. So the other drugs that are used are baclofen, which Medicaid or Partnership Health pays for, Medi-Cal, and Xanaflex, which was used mainly for people that have MS or spinal cord injuries. That's a drug that I take as a muscle relaxant. It was prescribed 4 times a day. I take a half of one at nighttime. After I get off work and go home, not my lower back, my upper back is just as tight as a drum. And if I take a half of one of those medications prescribed by a physician, I get up in the morning without the muscle relaxants, or I get in a hot tub instead. The tizanidine, which is that drug, is very similar to clonidine, so it can cause that hypotension also. And so we suggest not combining it with other drugs like ciprofloxacin that can cause that itself, and to use caution with that drug, which can cause very low blood pressure. So I've happened to have experienced that. If I happen to take that drug, if I take it right before I go to bed, a half a tablet, I'm fine. If I take it an hour before I go to bed and I stand up quickly, it could cause that kind of a problem. So I'm just not giving you information that's given to us, and of course it's HIPAA, and I'm not supposed to tell you what I'm doing. But I feel like the aid to the community is much greater than me trying to protect my health information. So there's going to be a lot of payer rejects for muscle relaxants in older patients. Many of those meds are on the Beers criteria that we have for risky drugs for the elderly. And if you're taking one of those medications, you may see your insurance neglect to pay for it. So again, it becomes complicated. We tell you what's going to be good for you, and then we find out side effects, and it's not good for you. And again, we'll talk about opiates at another time, where some of the marketing information that when opiates first came out were the same thing we tell patients now when we suggest that they get off the opiates, that they can have a better life. And that necessarily wasn't the truth, and in most cases it isn't the truth. You'll see more inhalers out right now for COPD. You see them on television advertised all the time. There's going to be long-acting, more long-acting steroids and more long-acting beta agonists, and you'll see them put together as combination inhalers. They cost about $350 a month, but that's less than if you bought 2 separate devices. So there's no proof that one works better than the other, so we would recommend it to a physician based on payer coverage, dosing frequency, and the kind of inhaler device you use. You'll see more and more of those spiral inhalers now that, or the inhalers that crush the capsule rather than just send a propellant into your mouth. Most of them don't send the propellant anymore because there was a chemical in there that caused some side effects. So now you breathe it in rather than have it forced in, and you need to practice the best way to use these inhalers. As we talked about many times, you will get a physician, because you're not using it properly, prescribe it another inhaler for you, and it's because you're not efficient with the inhaler you use. Even with a rescue inhaler, even with Proventil, albuterol, you have to let that saturate in the tissue of your lungs before you get that second dose. I don't know how many people that it says take 2 to 4 puffs, every 4 hours is needed for breathing, and they will go 1, 2, 3, 4. Well, you're roughly getting about 12% of the 100% that you should get from that inhaler. these aren't cheap anymore. You're not going to see, if a physician writes for a 2-week supply and 10 refills, your insurance isn't going to pay for that second inhaler when you run out. They will okay a month's supply one time. So you need to make sure that he writes it for a month's supply. We will ask physicians to rewrite the prescription if they only write it for a couple of weeks' supply, so we can fill it when you run out. Questions have come up whether or not it's safe to use a non-steroidal anti-inflammatory after there's a fracture or orthopedic surgery due to concern about delayed bone healing. And they do inhibit prostaglandins, which is a chemical that stimulates bone production, especially in the early phases after a break. And some animal and observational studies suggest that it might delay or prevent bone healing, but other studies show there's no effect. So here we are again. We're in a situation where, after I broke my femur last year, I was asked not to take the non-steroidal anti-inflammatory 2 days before surgery. Immediately after surgery, it was prescribed while I was still in the hospital. But there's continued to be cautions about using them in patients with maybe kidney function, that it's a high cardiovascular risk, or gastrointestinal risks from previous ulcers or taking steroids. So don't be surprised if your orthopedic surgeon prefers to avoid them in patients with more complex fractures or spinal fusions, or if there's any sign of delayed healing. They can take your bone density test and find out what your bone density is. So again, it's another one of those things that we have to be aware of. I don't expect you to memorize this. I don't expect you to know. Maybe it will repeat itself in the future, and we'll have a better idea of this being standard of practice, but at this time we really don't. And here's an example of one of those things that we warned you about for a period of time. There was boxed warnings, which means when we dispense a medication, there's a big black box that pops up on the information sheet that tells us this is a dangerous drug. And this was about Chantix, which was a drug and is a drug to help you stop smoking. And there was a black box warning that warned about mood changes, agitation, nightmares, and other psychiatric risks, as well as potential suicide. And that made a lot of physicians cautious about not prescribing Chantix for smoking cessation. But now there's a huge trial that suggests that these meds do not increase psychiatric side effects in patients quitting smoking. In fact, that may be due, the side effects may be due to just quitting smoking itself. Nicotine is a very powerful chemical. We continue to advise patients on Chantix or other drugs that can help you quit opiates, buprenorphine, to report changes in their mood or thinking or behavior. But pretty comfortable now in prescribing these meds for smoking cessations, including patients with stable psychiatric conditions. Remember, mental illness is a disease, but it can be controlled. High blood pressure is a disease, and it can be controlled. Diabetes is a disease, and it can be controlled. So you can be stable and still have a disease diagnosis. So for many people, they need maybe the nicotine patch or the chewing gum to help them get through it. But there's a great discussion on whether or not this smoking cessation, it can go back to using Chantix or not, and most of those side effects seem to be due to quitting smoking rather than the medication. So forget what we told you in the beginning, and realize now that what might have seemed to you to be a high risk at the time isn't really a high risk anymore as far as your physician determining that. So we've got a little bit of time left, and we're going to talk about some myths that you may or may not be aware of. And one of them is gluten. And as much as you see gluten foods being advertised and gluten foods taking more and more space in the supermarket, there's only about 7% of Americans who may have a reaction to gluten, and there's no reason to avoid it. In fact, it may be good for you by reducing blood pressure, blood glucose, and inflammation. Gluten-free doesn't necessarily mean healthier. Gluten-free foods often have fat, more sugar, and are more expensive than other foods. So every time I go in the grocery store, I'm amazed at the space that they have available for gluten-free foods and the amount of that I see in the shopping carts. So this was from Consumer Reports, and I respect their health information most of the time, and I feel that way on a lot of medications also. And one of those that they talked about was the little purple pill. Now that's not Viagra, that's the purple pill, not the blue pill, and it's Nexium. If you have an occasional heartburn, you can probably get some relief with fewer side effects from a less expensive over-the-counter remedy like Rolaids or Tums. Nexium has advertised itself as an innocent-sounding little purple pill, and that's contributed to an overuse of that drug and other drugs that are called PPIs. Those are protein pump inhibitors that keep the acid from being formed. We had protein blockers, we had protein maskers like Rolaids and Tums. In fact, up to 70% of the people who take Nexium and similar PPIs may not need this potent medication. And there's some, when Nexium and Prilosec and those drugs first came out, they were concerned about people developing cancer. And so you were limited to 30 or 60 days. Now there's not that risk, or doesn't appear to be that risk. I have taken a drug called Protonix, which is in the same category. Again, I'm giving you my health information since 2003, since I had colon cancer, and I was prescribed that because of the acidity in the colon. And now they say these drugs have an increased risk of heart attack or stroke, that everybody doesn't need to be taking them. And we have the issue that I've talked to you about many times is do we really need this medication? Do we just not want to change our lifestyle because we don't want to be inconvenienced? We want to just keep drinking and eating and making sure that we do everything that we used to do, and then we have a difficulty in getting off of that because it's easier. We take more and more insulin, more and more anti-diabetic medications because we don't want to quit eating sugar and fats and carbohydrates. We take more and more protein pump inhibitors because we want to drink beer and wine and eat pizza. We do the same thing with blood pressure medication. Rather than diet and exercise, we'll increase our blood pressure medication to as high as we can go in order to keep from changing our lifestyle. So we need to be aware that those things can be really expensive, and really expensive to health care, and really expensive to yourself as far as the new cost of health care goes. Diabetes is exercise mostly, and after a meal, activity may benefit with type 2 diabetes. Researchers found that volunteers who took 3 10-minute walks, we talked about this a while back, not a whole hour, not a whole half hour, 3 10-minute walks, your blood sugar can drop by 12%. That's huge. And a lot of people now are going on the internet because they can't afford to go to a doctor, and they go on demand and they get MD Live or for $49 for a 15-minute consult. You don't have any idea who you're talking to. experts from consumers said those kind of doctors should be reserved for simple concerns such as coughs, sore throats, short-term diarrhea, or you could even call your pharmacist, how about that, and buy something over the counter. So there are ways that this medical stuff can backfire if you're taking too much care and your financial thing is too much. Ignoring medical bills is what a lot of people do. Try to pay something on your medical bill. We had a patient the other day that hadn't paid us for a year. We finally went on a website and found out that the person still existed and was getting the mail. And we just asked to pay, if it was $20 a month, pay $20 a month. And that patient is doing that, and that's fine with us. Skimping on meds is going to put you in the emergency room, so do whatever you can. Don't cut those pills in half if that wasn't your purpose to start with. When you accept free samples, that doesn't go into our med file. So if you're starting to have a side effect, or if you're on mail order, and all of a sudden you come to us for an emergency med, we don't know what you're taking. It's really, really dangerous to take free samples and not at least let your pharmacy know, or even if you're on mail order prescription. So, and don't go online and self-diagnose yourself. So we just care a lot about taking care of you. We don't want to worry about you getting sicker because you're trying to get healthier. So we are going to remind you now that we're still delivering in this weather that's out there. Let us know a day ahead of time. We'll transfer your prescription over to us if we're not already bringing your prescription to you. We deliver to Kelseyville and Lakeport and Nice, Lucerne, Upper Lake, and be more than happy to get your medication to you. No cost for delivery. We're still doing immunizations. We want you to know that we're here. We're out of flu vaccines. We won't have flu vaccines now until next year. But pneumonia, for Zostavax, for shingles, for all those other kinds of medication, tetanus, hepatitis, all but hepatitis C we can do. So we'd like to remind you that we're North Lake Medical Pharmacies with 2 locations for you. The 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. Or outside the Bruno Shop Smart at 347 Lakeport Boulevard. Call us there at 263-1328. Thank you, Paul.
Thanks, Bill. We'll see everybody back here again next Tuesday for Health Talk on AM 1270 and 96.5 FM KXBX Lakeport.